Hello and welcome. In today's video, we are going to briefly discuss ectopic pregnancy. This video was created in order to give you a basic understanding of ectopic pregnancies. Nothing mentioned in this video is medical advice. Should you need medical advice or medical attention, please contact your primary care provider or go to your nearest emergency room. So, what is an ectopic pregnancy anyway? An ectopic pregnancy occurs when a fertilized egg implants and grows outside the main cavity of the uterus. This condition is also known as extrauterine pregnancy. The most common site for an ectopic pregnancy is within a fallopian tube, which is why it's often referred to as a tubal pregnancy. However, ectopic pregnancies can also occur in other locations, such as the ovary, abdominal cavity, or the cervix. Ectopic pregnancy is a serious condition requiring prompt medical attention. Early diagnosis and treatment are crucial to prevent complications and preserve fertility. The only surefire way to know if you're having an ectopic pregnancy is to see the doctor. Ectopic pregnancies are diagnosed through a combination of medical history, physical examinations, and diagnostic tests. Usually, the doctor will inquire about symptoms such as abdominal pain, vaginal bleeding, dizziness, or shoulder pain. A pelvic examination may reveal tenderness in the pelvic area, a mass in the pelvis, or pain upon moving the cervix. Ultrasounds can be used to diagnose ectopic pregnancies too. A transvaginal ultrasound is the most reliable method for diagnosing an ectopic pregnancy in most cases. A transvaginal ultrasound involves inserting a wand-like device into the vagina to get a clear view of the reproductive organs. The absence of a gestational sac in the uterus, along with the presence of a mass outside the uterus, can indicate an ectopic pregnancy. Sometimes, an abdominal ultrasound is also performed, but it is less sensitive than a transvaginal ultrasound. Another method used in diagnosing ectopic pregnancies are blood tests. Measuring the levels of the hormone human chorionic gonadotropin, HCG, in the blood. In a normal pregnancy, HCG levels double approximately every 48 to 72 hours. In an ectopic pregnancy, the increase in HCG levels may be slower or plateau. Progesterone levels can also be measured to help determine the viability of the pregnancy. Low levels may indicate a non-viable pregnancy. Ultimately, ectopic pregnancies are typically diagnosed using a combination of symptom evaluation, physical examination, transvaginal ultrasound, and blood tests to measure HCG levels. If these methods are inconclusive, diagnostic laparoscopy or other imaging tests may be utilized. Early diagnosis is essential to manage an ectopic pregnancy and prevent complications. The primary symptoms of an ectopic pregnancy include abdominal pain, vaginal bleeding, shoulder pain, and gastrointestinal symptoms. Severe symptoms like intense abdominal pain, heavy bleeding, and signs of shock indicate a medical emergency and require immediate attention. If you are pregnant and are experiencing these symptoms, then you may need to go to the emergency room. As we draw to the end of this video, there are a few things you should remember. First, ectopic pregnancies are very detrimental to your health. If you experience any of the aforementioned signs and symptoms of an ectopic pregnancy, please seek urgent medical attention. Ectopic pregnancies can occur for a wide variety of reasons. Ectopic pregnancies are not uncommon and happen to millions of women of childbearing age every year. If you happen to experience an ectopic pregnancy, don't be discouraged. You will have another opportunity to conceive in the future if you are in good health. After an ectopic pregnancy, your body will need some time to heal. If you experience any negative and intrusive thoughts after your pregnancy, just know that you're not alone. There are many women that have went through similar trials and tribulations. Speaking to someone could help with these thoughts. It's always recommended to see a licensed psychologist and other similar mental or behavioral health specialist. This video was not meant to cover ectopic pregnancies in great detail. However, it was intended for you to get a basic understanding of this condition. Please pass this information along to someone who may need it. Thanks for watching the video. Let us know your thoughts and comments down below. I hope to see you all in the next one. Until next time, see you then.